Patients that are acquiring infections in a healthcare system, the first thing you want to think about is this something they brought in from the community? And so patients who come in from the community, regardless of their immunocompromised or not, are still at highest risk for infections with common pathogens. So if they have a pneumonia, things such as Streptococcus pneumoniae, or if they have a urinary tract infection, things like E. coli or other gram-negatives. Once they are hospitalized, often because of a more prolonged exposure to the healthcare system, they are at risk for certain drug-resistant pathogens that are circulating in the hospital setting. And so we think about things such as MRSA and VRE resistant gram-negatives. And then in addition to that, these patients are susceptible to bacteria, viruses, and fungi, some of them from environmental exposure that the rest of us, due to having an intact immune system, would be fine coming in contact with, but can cause significant invasive disease when one has an impaired immune system. So we have to begin to think about things that might be in the air or in the water. And so we think about water systems and the risk for Legionella. We think about building construction and the risk for various aerosolized spores. And then we think about viral risk. And many times that's a reactivation that someone may have been exposed to in the past, but now because of an impaired immune system, they're at risk for. But they can also pick up these viruses from others they come in contact with in the hospital.